Good afternoon. My name is Nicola Willier-Fenton. I work in UVM's Continuing and Distance Education Department, and I'm so thankful that you are here to join us for the next hour to talk about COVID-19 strategies for managing your mental health. We have an all-star cast with us today. I'm so looking forward to hearing from Dr. Carney, Dr. Burns, and Michael Nilo on so many different tips and strategies, and also just the latest is what's happening out there in our COVID-19 world, as we are seeing an incredible week this week as the first vaccines have made their way across our country and here in Vermont. We're going to go over brief introductions. We will talk about COVID-19, current trends, vaccine, community needs from Dr. Carney. Getting through the pandemic marathon, we know that you all are experiencing pandemic fatigue. It is real. We're all experiencing it. How can we make it through this last hopeful phase of the pandemic? Skills for wellness, coping, recovery, an overview of the UVM Master of Public Health program, which Dr. Carney leads through the Robert Larner College of Medicine here at the University of Vermont. We will have plenty of time for your questions. And I also do want to let you know that we will have a digital badge for participation. You are going to learn so much information today. You can share that information and the fact that you have learned so much on your social media profiles, and we'll share that information at the end. And as always, we have a lot of resources for you to walk away from today's presentation. So as I mentioned, I would like to do brief introductions. Dr. Carney has been with us for many years, and over this pandemic has been just an incredible source of information. Thank you, Dr. Carney, for leading the way of our information in our community. Dr. Carney is the Associate Dean for Public Health and Health at Larner College of Medicine and a Professor of Medicine, and she runs our public health program as well. Thank you, Dr. Carney. In addition, we have Michael Nilo. He is in his 4th year at medical school at Larner College of Medicine. He's a candidate. He will be graduating in the class of 2021. And Michael, we're so thankful to have your perspective today as well. And also joining us, Dr. Catherine Burns, who likes to go by Kath. Kath joins us from COVID Support Vermont. So many amazing resources that her team has put together that we are going to share with you today. She is a licensed psychologist doctorate in the state of Vermont and also is the quality director of the Vermont Care Partner. Thank you so much, Kath, for being with us today as well. We do have a chat box that I've already seen folks using. Thank you so much for already being active. We will keep our closest eye on the questions in the chat box and direct them to our presenters today. Throughout the presentation, our team members will do their best to put up links and information, and we are also recording this. We will share the presentation with everyone who has joined us today and everyone who has RSVP'd, and we're happy to share the resources that are listed today. So we have a lot to get to today. So I'm going to start with Dr. Carney. Dr. Carney has been really the most incredible person to guide us through this pandemic from so many different perspectives, but the information that you have provided over the last 9 months has been invaluable to our community. So Dr. Carney, we're going to ask again, lead us through this next phase as to where we are with the coronavirus and what we can do to continue the marathon as well.
Thank you, Nicole. All right, well, we're going to start with, there are a lot of new exciting developments to talk about, but let's start a little bit with the trends. So this is from the Johns Hopkins Coronavirus Resource Center, which is a great source of up-to-date global information. You can see the orange line is at the United States, and we're still having an increase both in numbers of cases and deaths. And you can see some of the trends in the other countries as well. Next slide, please. A little more granular across the United States, and this is cases in the last 7 days, and it's expressed as a rate. So you can see whether a large state or small state, the darker areas have more cases. What's happened in the last week? And you can see we still have a lot of coronavirus cases being reported across our country. Next slide, please. This is from our own health department's website, and this slide is a little bit busy. You can just see the trends since March. They have a spectacular website. It's updated on a daily basis. They have a coronavirus tracker. They have weekly updates about different aspects, and I would encourage people to use this as an up-to-date resource. One of the things I'll point your attention to is this percent positive. and it's been 1% sort of overall, but about 2% recently. And that gives us a sense of what is the level of coronavirus disease in our community. So that's an important thing as the health department makes available more and more testing to people here. Next slide, please. This is a slide from one of the expert groups looking at, as we had in the 1918 influenza pandemic, different disease, but we saw waves. And the key word here is waves. And what might we see? No one really knows. But if you look at this, that sort of middle picture, it's a little bit ahead on this figure, but what we appear to be experiencing is still we're on the upslope of what might be considered a second wave. And why I emphasize that is we're still on the upslope, which makes our public health actions, even as we talk about the vaccine and its rollout, critically important. Next slide, please. Let's talk for a minute about vaccines. Next. This is Operation Warp Speed. And sort of that name kind of scares people, and this is a graphic from the Department of Health and Human Services, but it shows you a diagram from the companies on the left to getting the vaccines into the arms of people in long-term care facilities and healthcare settings throughout our country. What I want to reinforce is just because this is happening in such an intensive and comprehensive way, that doesn't mean there's any shortcuts. All of these vaccine candidates, and what is truly remarkable is the scientific, medical, and public health achievements that have happened at such a dramatic speed. It's just frankly incredible. But the oversight for these and the quality control and the scientific scrutiny of each and every one of these candidate vaccines all the way through to the emergency use authorization from the FDA remains the same. They go through these 3 different phases, and I won't go into those in depth. I just want to assure people that these have rigorous oversight, and in addition to the thousands of people who are part of these clinical trials, after that vaccine is administered, it's followed very closely for any unintended side effects or things that could not be anticipated. And so there is really a close oversight of the entire process. I did put at the end, Nicole, there's a coronavirus tracker, and actually the New York Times does this. It's updated. It has great graphics, and that is a resource I'd recommend to people. I think it's very high quality. Next slide, please. Our favorite Dr. Fauci explains how to end the pandemic. And we all love living, hopefully all of us love listening to Dr. Fauci, who's just been an incredibly talks about here, and the references here, and it's in Scientific American. He talks about the need to maintain our public health protections as we roll out the vaccine, and he also talks about the exciting developments that are happening and continue to happen as we look for better antiviral medications on the treatment side. So the medical research is extraordinary and continues at a rapid pace. Next slide, please. A little bit about herd immunity. There's been a lot of discussion about what does that mean, why it's important. This is a graphic from the National Institutes of Health, and the blue figures are people who are not immunized and healthy. The red figures are those who are not immunized and both ill and contagious. And then the people who are yellow are immunized. So if you see on the top, and you can just imagine, this is just a generic scenario, but imagine with a given disease that you have most people who are not immunized and still healthy. And then when you say you have a couple of contagious people, you look to the right and you see a lot of contagion out there. If you look at the middle scenario, where just a few people get vaccinated, you still see to the right an awful lot of infection. But on the bottom scenario, when you immunize the vast majority of people, and what is that precise number? People are talking about rates of 70, 75% as a lower limit to get everyone to get vaccinated when it's available. Now, when you introduce a person who is contagious, the infection has nowhere to go. That's the concept of herd immunity. Next slide, please. This is from the Institute for Health Metrics and Evaluation of the University of Washington School of Medicine. And this is an example of a scientific group that's been trying to do forecasting modeling. And there's been some controversy around that and some criticism because the numbers, it's very hard to do these kind of predictions. What I think these models are extremely useful for are visualizing different scenarios of things that we can do to protect ourselves. So if you look, that solid line is what's actually happened. On the left-hand side is the number of people who have died. And right about kind of towards that orange part, almost to the far right of the graph where you start to get those dotted lines, you see some projections. That you can see that the deaths go up if we eliminate all of our restrictions that we have. We go back today, if we went back, life is normal. You would see much more spread and many more deaths. If you look at the green line, that is sort of the lower one, that shows what is the projected decline over where we are now if everyone wore masks. So if you look at some of these very seemingly simple but highly effective public health measures, you can see the potential impact and benefit of that in the entire population. And then those ones in the middle look at if you first give the vaccine to high-risk groups, which is what we're doing now, is that rollout, particularly in addition to those frontline healthcare workers, it's also people who are in long-term care facilities. We know they're at the highest risk. What you can see in terms of decline. Next slide, please. So controlling the pandemic, remember the vaccine has come out. It's exciting news. It's going first to people working in healthcare who've been working so hard and so long to help protect the public and take care of them, and also people in long-term care facilities. While that vaccine is rolled out and new vaccines are under review as of today, those public health measures continue to be extremely important and absolutely essential for right now. Wearing that mask. If everyone wears a mask, when I wear a mask, I protect you. When you wear a mask, you protect me. Those are from those people who have no symptoms, but they're still able to spread COVID-19. Really, really important. And we just saw the projection for that. If everyone does that, we can see tremendous benefit. While we're waiting for that vaccine rollout and better treatment, and we really do want to see an end to this pandemic. That physical distancing, staying 6 feet apart. In Vermont, that's a CalLink, right? And then avoiding those crowded places, the size of crowds and keeping out of crowds, all those things continue to help us. Next slide. You mentioned at the beginning, being patient is hard. Everyone has pandemic fatigue, and I agree that that's real. But if we're all able to be patient for a bit longer and be confident that our public health and prevention science is really effective, we'll get to the finish line all the better and all that much faster. So I just wanted to make that point before we go on. This is my last slide. We recently did a study with the second-year medical school class, the class of 2023 at Larner College of Medicine, and the United Ways throughout Vermont, and particularly the United Way of Northwest Vermont, who we've partnered with for many years, to ask people about what is the impact of COVID on our communities. And so we had an electronic survey that reached more than 1,000. We got more than 1,000 responses all over Vermont, and asked about basic needs, healthcare delays, equity and discrimination, how people get health information, access to mental health care and substance abuse treatment, and a whole range of questions. We found that, looking at this, some of the largest impacts are things we're talking about today, as social interactions, people's income, access to childcare, health care, and caring for the elderly. We saw some differences in rural Vermont, delays in substance abuse care, access to mental health and dental care, as well as tremendous financial stress. And with regards to food security, the People in less rural areas, what we call our urban areas here in Vermont, had concerns for food availability and where to find it. And in the rural areas, affordability was a predominant concern. Mental health, lots of concerns about isolation and or stress. And we're so glad we were able to do this with the United Ways throughout Vermont. And I think this really reinforces what we were all suspicious of, really the extent of health, public health, and social needs throughout our state right now, and things that I think we can help with. So, Nicole, I'm going to stop there.
Thank you, Dr. Carney. Thank you for grounding us in just what's happening right now in the vaccine process and encouraging us to make it through the next several months as there is a light at the end of this tunnel. And I know, Michael, you're going to bring us through quite a bit of information, and I think this is a great title. It is a marathon. It's not a sprint. It's not a short race. It's a very long race. And so I want to toss this over to you and to see some of the information that you've been studying and researching on as to what is happening out in our communities. Michael?
Sure. Thank you, Nicole. So I will be discussing mainly the trends in food security over the last 9 months, but I'm just going to start off with a short discussion on some of the mental health aspects in a few specific populations, but I'll leave most of that discussion to Dr. Burns. So if we look at the pandemic, it has had a great effect on everyone, but there are some interesting findings within the literature when we look at healthcare workers and college students specifically. Healthcare workers have been on the front lines throughout the pandemic, and many studies have shown very similar findings when it comes to the effects on their mental health. Among healthcare workers, we've seen increases in anxiety, depression, and poor sleep quality or insomnia. This particular graph is from a study of healthcare workers in China before and during the start of the pandemic. And we see sort of these increases in these three areas. What we don't see, surprisingly, is that even though our healthcare workers have been on the front line throughout the pandemic, we don't see a significant difference in post-traumatic stress symptoms, which we have seen in patients with COVID who have been stable or have recovered, or in past pandemics when we look at healthcare workers in those situations. Next slide, please. With the pandemic's effects on the delivery of college education, studies have shown that college students are experiencing uncertainty and anxieties secondary to the absence of structure, boredom, and just not feeling engaged. The inability to meet with friends or engage in in-person school activities has resulted in lower affect as well. Next slide, please. This graph is from a study done with college students in Texas. It found that 71% of its participants actually experienced an increase in their stress and anxiety directly due to the pandemic. They cited stressors such as issues with concentration, sleep, eating patterns, social isolations, concerns regarding their academic performance or living environment or financials, and fear and worry about their own health and the health of their loved ones. And alarmingly, 44% also reported an increase in depressive thoughts as a result of the pandemic. Next slide, please. So I'll leave the rest of the mental health talk to Dr. Burns, and I'll segue into my main topic of the presentation, which is another complicating stressor as a result of the pandemic, which is food insecurity. Nutrition is incredibly important, not only for our physical health, but also for our mental well-being. And if we're unable to take care of our primary needs, think of things like hygiene, sleep, eating, then it becomes harder to take care of ourselves and our secondary activities, our work, our study, and our leisure activities. A diet lacking in proper nutrients can negatively impact our mental and emotional level as well, and our energy levels, and even our immunity and our ability to fight off the infection. And the pandemic has made it difficult on a lot of people to maintain reliable access to affordable, nutritious food, and has forced them to make some drastic changes in their diet and eating patterns because of it. A study done here in Vermont earlier this spring found that food insecurity actually rose 33% during the pandemic, from about 18% to 24% of our state population. And we've seen a significant number of once food secure households becoming newly food insecure, while households who were already experiencing low food security became very low food security households. About 2/3 of our food insecure Vermonters experienced job loss or other work disruptions like reduced hours, and self-isolation, social distancing, as well as lockdowns, travel restrictions, and other barriers to transportation and limitations on the workforce have affected infrastructure in ways that has caused food shortages, spikes in food costs, and disruption of nutritious food sources. Fortunately for us, panic buying, which we saw earlier in the pandemic, has quickly resolved, but that did have an effect on our local food availability at that point. But the challenges here, as well as limited access to food assistance programs and school food programs, means that people have had to change their eating and lifestyle behaviors while adopting some not so healthy coping strategies. So the next few slides, we're going to talk about some of the findings from that Vermont study that looked at some of the early food insecurity impacts of COVID. Next slide, please. This slide is basically showing us that a significant number of once food secure households became newly food insecure, while households who were already experiencing low food security became very low food security households. And a similar study done in Virginia showed very similar findings as well. Next slide, please. Households with food insecurity are having more difficulty with things like finding food, affording food, and accessing help with getting food. Next slide, please. And the pandemic has imposed stress regarding food expenses, food access and availability, as well as food safety. Next slide, please. This graph is from a study done in Taiwan, which shows relative search volumes, or RSVs, on Google of keywords related to food security before and during the early stages of the pandemic. In the early stages of the pandemic, people became increasingly more concerned regarding their food security, and these concerns were shared globally in both developed and developing countries. If we go back to the Vermont food security studies, it showed that actually less than 30% of people who identified as having food insecurity participated in food assistance programs or similar resources. Next slide, please. Instead, food insecure households have adopted other coping strategies. And based on studies done here in Vermont, as well as in Virginia and Florida, nationwide, people are purchasing lower cost, non-perishable processed foods that are often more calorie dense, but lower in key nutrients, and not buying as much fresh food. They've adopted irregular eating patterns, like eating less, but snacking more on sweet and salty snacks. And parents are overly controlling or restricting their children's eating for fear of cost. Next slide, please. When asked, respondents said that looking to friends, family, and government programs or other organizations is often seen as a last resort option, and this may be due to stigma or lack of knowledge on how to find or navigate these resources. Next slide, please. So how do we manage nutrition at a time like this? So I'm just going to start with some general nutrition advice, recognizing that these things are often more easily said than done. But as best as you can, rather than eating less or skipping meals, it's important to try to eat more consistent, well-balanced meals. And as much as possible within your means, try to eat mostly a whole grain, high protein, high fiber diet. And this is important because these types of food will do a better job of filling you up, and in effect, less may actually go a longer way. By eating a satisfying meal at designated meal times, this can help you to avoid irregular snacking and help to reduce the intake and even the expenses of the salty, sugary snack foods that we tend to gravitate to in times of stress or boredom, which we've all had a lot of during the last 9 months. And not to mention that a more nutrient-rich diet will help you to feel more energized and less fatigued in order to tackle the marathon that is the pandemic. Fast food may be convenient and sometimes cheap, but it's not always a cheaper option, and definitely not a more nutritious option than cooking at home. And cooking at home, especially for those who live with others, can also give you the opportunity to spend time with loved ones and provide some sort of purposeful activity in your day. Next slide, please. People have turned to more shelf-stable items, often canned foods, frozen foods, or other processed food items, and fewer fresh options because of cost or trying to limit trips to the grocery store. There are produce options, though, that have a longer shelf life, and I have some of these on the slide. So for example, in the wintertime, root vegetables like radishes or beets are a good, long-lasting, shelf-stable item. And while canned vegetables and fruits are also shelf-stable, they're often packaged with preservatives that actually make them less healthy than their fresh counterparts. So if fresh produce is hard to come by, frozen vegetables can be another affordable and similarly nutritious alternative, while things like dried beans can actually be a cheaper option. And by maintaining safe food practices, like remembering to properly store your food and use it before it goes bad, you can reduce food waste and wasted money. And believe it or not, overcooking your vegetables can actually cause vitamins and minerals to be lost. So to get your full money's worth of nutritional value, it's best to try and eat fresh, raw vegetables or try to keep yourself from overcooking them. And finally, I do realize that it's hard to practice these principles when the main problem is inability to access or afford food. So it is important to know when and where to ask for help when needed. And if we're able, to try and help others who may be having difficulty as well. Next slide, please.
Michael, I just want to pause there for just a moment because you raised so many good points. And I wanted to say thank you to Pamela, who has put in the chat box that she is a volunteer at the Family Room in Burlington, and next week on Tuesday and Wednesday needs help delivering food for some families around town for the holidays. First of all, thank you, Pamela, for what you're doing and volunteering. Thank you to the Family Room. And I'm already seeing people in our community right now in the webinar volunteering to help. So thank you very much for recognizing how important food insecurity is and how important that is to provide those meals to our community members. So thank you, Pamela, and thank you to the folks who are offering. Michael, I'll let you continue.
Sure. Yes. Thank you, everyone. So here are some resources to help you if you're having trouble accessing affordable, nutritious food. Vermont 211 can help get you connected to a number of important community resources, including emergency food. And you can call 211 or visit the website at vermont211.org. Next slide, please. And on their website, you can find help navigating things like applying for food stamps or vouchers and other public health nutrition programs. And you can find information on food pantries and other food distribution programs, as well as programs that provide meals like soup kitchens or home delivery. Next slide, please. The Vermont Food Bank is the state's largest hunger relief organization, and through their website, you can find agencies in your area that have food programs. So just to give you an idea, here's a map that actually shows the agencies located within a 25-mile radius of Burlington. Next slide, please. Another organization is Feeding Chittenden that works to alleviate hunger for food insecure households throughout Chittenden County. It is the largest direct service emergency food provider in Vermont, and their website includes a number of community resources, including a list of where to find free groceries and free meals in the area. Next slide, please. So just to bring things back to the title of the presentation, it is important to remember that we're in a marathon and not a sprint. And I recognize that the last 9 months have not been easy by any stretch of the word, and we've had to make a lot of changes in our lives. But in order to set ourselves up for success for many months to come, just as you'd prepare for a real marathon, we need to pay special attention to taking care of ourselves through the winter and into the spring. And that includes things like eating, sleeping, and exercising well, and that's all just as important as a real marathon. Making plans for ourselves and creating routines and try to find meaningful, purposeful activities throughout our day is important. And as best as we can, try to remain social, even if that has to be through a phone or computer screen. Last slide, please. And I can't stress enough that as the holidays come and pass, we do need to make sure that we're doing what's best for ourselves and others. And we need to make sure to look after ourselves and our loved ones, even if we can't be together physically. So if anyone you know is having trouble and could use what you learned today, please do pass the information along.
Thank you, Michael. Thank you so much for sharing what you're seeing out there in our community across the state and connecting people to resources. I really appreciate that. Dr. Burns, you are also on the front lines of the community needs and community support. So I know you have a lot of amazing information, and COVID Support Vermont is connecting with many Vermonters. And my job, I think, today is to make sure that all the people with us know that this is a resource available for them and to spread that word to make sure that they know that this is something that is out there for them. So, Dr. Burns, can you take us through the information you'd like to share?
I can. I really appreciate being invited on this panel today, so thank you very much. And my job today is to talk about this program called COVID Support VT. And some of you may have heard about this already, but let me tell you a little bit about how it's funded and where it's from. So when a state has been declared a disaster by the president, which all of our states in our country have, they have access to these funds for this program through FEMA, which provides communities with mental health supports, not designed to replace an existing mental health system, but to supplement it. So our program here in Vermont is managed by Vermont's Department of Emergency Management, as well as by the Department of Mental Health. And then it's administered by Vermont Care Partners, which is who I work for. And that's a network of 16 agencies across our state that supports people with mental health, substance use, and intellectual and disability services. And all of those are located in your community. And I mention that because that's one of the many services that's available to Vermonters today. And in Vermont, while I would say we often feel like we just don't have enough mental health services, we actually have some of the most services and best access in the country to mental health services. So let me move ourselves forward here. So the goals of what I'm going to go through in the next few minutes is just to learn a little bit about the pandemic and the state of emergency and its effects upon overall mental health, to understand some common reactions that I'm guessing all of us on this webinar can relate to, and to explore what promotes our recovery from these types of reactions and from this disaster, and the supports that we can find through COVID Support VT. So first, let's be clear about what a disaster is. It's a natural or human-caused occurrence, and that causes human suffering. And what is particularly unique is that the disaster creates this broad need, and we've just heard about these broad needs around food assistance and access, but this need overwhelms local resources and it requires additional supports. What's really unique about this pandemic as a disaster is that unlike other disasters, like when Vermont went through Tropical Storm Irene, this is not a point-in-time event where we have a clear event and we have a clear opportunity to recover from that event. This is ongoing, hence the reference to the marathon made by Michael, and it's really affecting all of us. It has this unbelievable ability of exacerbating and intensifying disparities that already existed, and it's just emphasizing the risks that we see to our overall health and mental health, not just from the virus, the effects of the virus upon our physical health, but because of increasing worries of becoming ill, either ourselves or with someone who's close to us, or by just the increased effects of loneliness, fear, stress, and isolation that have been well documented in impacting our ability to function and be well overall. So just briefly, one of my goals here is to try to dispel this notion that if you're struggling, there's something really wrong with you. In fact, what we're finding is that all of us are experiencing negative impacts from this pandemic. So the Kaiser Family Foundation did a study, and it's an ongoing effort, back in March, where they actually surveyed adults in our country to find out, and they asked the question, are you negatively impacted? Is your mental health negatively impacted due to worry or stress over the coronavirus? And in March, you can see that about a third of respondents said, yes, it is. And then when they reran the study in July, that went up to over half of people. And I would guess when this study is run again, it's going to be much higher. So all I can say is that if at least half the people in the country in July, when things were not as intense, were suffering mental health effects, I would expect it to be much higher now. We know that in the same study, they compared this result for people who shelter in place to people who don't shelter in place. And if you're by yourself, sheltering where you are, nearly half of those people said they were suffering negative mental health impacts. And then again, we know people who are elders are particularly at risk. In July, nearly half of the people who were surveyed who were over 65 said that the coronavirus stress had a negative impact upon their mental health. And this list I'm putting up with you are people that we know who historically suffer more negative impacts in terms of their mental health from disasters. And when we look at this list, we see elders, people with pre-existing mental health, substance use, or medical conditions, people with a trauma history, people with intellectual and developmental disabilities, caregivers, and I added of anyone, people of color, migrant workers and or new Americans, first responders, essential workers, people who live alone, children and youth, people living with an economic stressor or resulting impacts from the pandemic. Honestly, I'm guessing most of the people on this webinar would identify with at least one element on that list. So the first thing to do in terms of understanding how to manage it is to understand what your reactions might be. And what you see here is a list that's from FEMA of common responses to stressors related to disasters. And you see a variety of physical reactions here, from stomach aches, headaches, weight change. In fact, we do an informal survey on our website where we ask people about some of the effects they see, and actually weight gain is one of the first ones that people identify, likely related to the food issue that we discussed earlier. In terms of emotional reactions, we see some people having initially, when a disaster occurs, having these massive feelings of heroism, euphoria, because they're ramping up to do something about the disaster. But then people often descend into anxiety, fear, depression. A number of cognitive reactions around feeling disoriented and confusion. A lot of people talk to me about just losing track of time, feeling like one day blends into the next, having nightmares, feeling preoccupied with a disaster, and then finally behavioral reactions, having changes in your activity level, changes in your substance use, having difficulty concentrating, difficulty sleeping. And I would guess if this were an interactive webinar, people would be raising their hand saying, yep, I can identify with at least several on each of those columns. So the question is, what do you do about it? All right, and in the disaster world, we talk about how do you recover from disaster, and we know that people do, and we know they come out the other end from these things after the marathon, generally, if we can support them, doing all right. And it starts with good self-care, and Michael talked about some of that. We're going to talk a little more about that. Having accurate information, having good psychosocial supports, and then having access to resources for other needs you may have. So the first thing that I would like to talk about is very simple, but it's actually not, because I'm in the business and I keep forgetting to do a lot of these things. By developing some sort of a daily wellness plan where every day you figure out a way to take a break and let your mind stop. Some people call that mindfulness, other people call it doing something just to let your brain stop. Eating well, Michael talked a lot about that. Try and eat regular, well-balanced meals. Exercising, particularly if you can get outside, it's really helpful. And I don't mean run a marathon, I mean get outside and take a walk and move. Rest, follow a sleep schedule. I work with kids, and I know a lot of kids whose sleep schedule has really been disrupted by this event. Doing something you like every day. Connecting with family and friends every day, particularly outside of your home if you can. Monitoring your substance use and paying attention to if it's shifting and why. Managing your pre-existing conditions. You know, if you have a treatment plan for any kind of condition, following it and keeping in close contact with the people on your team. Monitor and limit your media exposure. So we live in a 24-hour news cycle. Notifications are on our phones if you have one. And it's really good to turn those off and to choose when you want to learn about the pandemic, because it doesn't make you feel better by having it on all the time. And then finally, practicing gratitude, finding a way to acknowledge what actually is working well. Now, I want to be clear that when I've had people say to me, you know, Kath, how is this going to solve my inability to find enough food? How is this going to solve the fact that I'm now underemployed? It won't solve it, but it will help make an unbearable situation maybe a little bit more bearable, which is what we're talking about here, is how to help you feel like you have all hands on deck to get you through this pandemic, out the other side of it, feeling all right. So the other thing I like to talk about is kindness, and I'm not being trite here. Kindness is really important, and it tends to be lost in a crisis situation. It's something we can teach each other and our kids. Kindness is very calming, both to practice and to receive, and providing kindness to others, frankly, makes us feel better. And you can see simply by asking somebody, are you okay? What can I do to help? How are you managing? Or I'm here for you. It doesn't mean you have to solve the problem. It means you're acknowledging someone else is there and you're being kind and you're willing to be supportive. And I can't emphasize enough how important that is, particularly during this time when we feel so isolated from one another. I get asked a lot about how will I know if someone else is struggling? What do I watch for? And because of stigma, a lot of people's feelings, if they're feeling badly, they don't want anybody to know, they don't want to be judged poorly for that. Frankly, we need to start asking and noticing other people. So here's some things you can watch for. So if someone you know or care for is talking a lot more about feeling concerned about their health or well-being, pay attention. If you're noticing sleep changes in someone's sleeping or eating patterns, or if you care for someone who you're noticing that in them, that's a good clue. If you're noticing someone is really struggling with concentration, that's a very good clue. The next two are around worsening of someone's health problems or worsening of someone's mental health conditions or substance use. That's a very good indicator. So if you see or hear those things, what do? A lot of people are afraid to ask. And actually, that's exactly what we want to do. We want you to reach out, and we want you to start by first modeling good self-care. It's just like when, if you've been on a plane and they say, please put on your oxygen mask first, we actually want you to do that. You have to model good self-care. Your kids, the people you care for, are watching you, and you'll be in better shape to support people around you. You want to talk about what you see in that person and ask how you can help. So, Kath, I'm noticing that you're really having a hard time concentrating at work. What's going on? Can I be helpful at all? Are you feeling stressed? You can reach out to a healthcare provider, either with the person or for them, or to your own to ask questions. You can seek support from a mental health provider, and you can find them in schools, if you're talking about kids, from an employee assistant program. A lot of them provide services to a whole family, from a Vermont Care Partner agency, from community and private providers, from your healthcare provider. A lot of them have integrated mental health providers. If you belong to a faith-based community, reach out to your faith-based leader. They're there and they want to be helpful, and they're trained to do so. And then communicate with trusted friends and family. If you're concerned for someone or for yourself, reach out to people you know who can be helpful in your circle. So specifically through COVID Support VT, what can you find? So first of all, on our website, covidsupportvt.org, we have filled it with a lot of accurate information about, up to date about the pandemic, about managing stress and mental health, and about apps, tips, approaches, things that you can do on your own to help you feel better. By calling 211 and choosing option 2, you actually can be connected with one of our crisis support counselors. It's free and anonymous. They're there Monday through Friday, 8 to 8, and they want to talk to you. And their job is to help you feel better in the moment and figure out an action plan that might help you move along. Again, it's free and anonymous, and we want people to call us. The counselors are providing virtual wellness groups on Tuesdays at 1 and 5. All are welcome. There's the information about how to link virtually or to call by phone is on our site, and we're happy to run wellness groups upon request. I'm doing one tomorrow. I did one last week. They're fun. We like it. And we try to connect people to agencies and services that might be helpful to them. And being embedded within 211 has just been so helpful because that is the hub in our state for finding appropriate services for related needs. So I think that's my part. Nicole, thank you very much.
Thank you, Dr. Burns. I want to ask a quick question. I know we have a few people typing some questions, I suspect as well. I want to ask a question. You just mentioned a wellness group that you're conducting them. Is it possible for people to gather a large group on Zoom or whichever platform you're using to ask your office to conduct a wellness group for a group of people? How would that work?
Yeah, absolutely. What they would do is go to our site, and there's information there about how to connect with us to actually request a wellness group. And what we would do is one of our counselors or myself, it's an hour workshop where we go through some of the information you saw today. So, because information is power, and if people have information, good information, they feel less stressed. We teach them about common reactions, and we take them through how to make a wellness plan that could work for them through an interactive activity.
That's wonderful. Thank you so much for sharing that. And I did see that Julie was asking the same question, so we were on the same page, Julie. Melanie has a question about vaccines, so maybe we'll come back to that in just a moment because we can circle back on some of those questions here. I just wanted to pause for a moment, and Dr. Carney leads our Master Public Health Program through the Larner College of Medicine, and we all are so much more aware of what that means today is our own public health. And Dr. Carney has taught me so much over the last several years as to what is public health. And it can be access, food insecurity. It can be sidewalks in communities to allow for walks, like both Michael and Catherine were talking about. And so public health is so broad and so big. And so I just wanted to pause for a moment and educate our listeners today about the program at UVM that is training more people in the exciting field of public health. So Dr. Carney, just a quick overview of what is UVM's Master Public Health Program.
Thank you, Nicole. First, public health is what we do together to assure the conditions in which people can be healthy. That's a big thing. That includes access to health care, all the social factors we talked about, public health issues such as tobacco use, alcohol use, substance misuse. So it is broad. What people are trained in a Master Public Health Program is in the science of public health. And we've had a huge interest as people are seeing, what people in epidemiology are really doing. And they're out there and trying to do everything they can to do contact tracing, track the pandemic, give great scientific advice to people. So things like biostatistics and epidemiology, kind of the quantitative sciences. Health policy, that's the healthcare things. Our human behaviors are really important. And in our program, these are what we call our areas of excellence. And the foundation of epidemiology is that language of public health. You learn all about it in disease tracking, global and environmental health, and then health policy, leadership, and advocacy. Because sometimes we have to advocate for improvements in policies to improve health for our entire state.
And one of the things that's so wonderful, and it was already an online master program, and now so many more people are comfortable with taking courses online. Maybe that's a benefit, I guess, that we've transitioned to that kind of coursework but it already was online. And so our instructors really have grasped for many, many years how to conduct incredibly interactive and informative courses online. So I just want to give that plug as well. And I love this slide because I think about public health, and many of us, of course, think of Dr. Fauci and epidemiologists and disease detectives and all these cool jobs that we've seen now in the public profile. But Dr. Carney, there's a lot of other positions that maybe people wouldn't have thought that would be as a result of the Master Public Health Program.
Yeah, that's exactly right. And there are amazing careers in public health. And in our program, we have people who already might work in healthcare or in research. It sort of depends on your perspective. The two key operative words are public health deals with populations and is focused on prevention. So preventing conditions that can either harm us or hurt us over the long term. And there's many, many opportunities in different areas.
And information, absolutely being out there and sharing with the public, which you have done so many times, Dr. Carney, thank you. Holidays, we just made it through Thanksgiving. In the midst of Hanukkah, here comes Christmas, New Year's Eve, Kwanzaa, various different holidays that people celebrate. So, of course, everybody's concerned about how do they do this safely? How do we maintain some of the efforts that all of us have put into place in our worlds over the last 9 months? As Michael said, it's a marathon. Please don't give up those last couple of miles of your marathon. Dr. Carney, just touch quickly on some of the points we're seeing here about how to consider safely celebrating holidays.
Everything I told you, keeping physically distant, wearing a mask at as much as you possibly can, and also avoiding crowds. And just remember that our community levels of COVID-19 are high. everywhere, pretty much everywhere. And so gathering with people outside our household is a risky thing right now. Think about indoors versus outdoors. Bundle up, go outside. You know, that's something that we're pretty good at here, and that's a message we've been trying to get out. Like to our students, spend some time outside. It's still beautiful, it's cooler, but and it's definitely safer. Durations of gatherings when you are with people, longer times versus shorter times. Shorter times are obviously way better, and then fewer people are clearly better. Traveling, sort of, that's not something that is really recommended right now because of the high levels of disease throughout. And then just sort of if everyone's being respectful and wearing a mask and staying home if they're sick, you know, we just want to reinforce that.
Thank you very much. And I know many people are trying to figure out how to do that safely. So thank you, Dr. Carney, and thank you, Michael and Kath as well, for sharing such valuable information. We do have several questions that are popping into the chat box here. I did want to just make one, before we get to those, I do want to share that you have an opportunity to show what you've learned today as well. And so our digital badge for participation shows the COVID strategies for managing your mental health. This is a really cool thing that you can add to LinkedIn, your social media, wherever you kind of play in the social space. It's really the resume, you know, of 2021 almost. But we just wanted to share that opportunity with everybody today, that there's information, and Kelly is putting up a link in the chat box that you can go to request your badge. It's free. It's just a really amazing, cool way to show the learning and that this topic is important to you or your organization that you might be with. So I just wanted to share that with everybody as well. And resources. Dr. Carney wouldn't be Dr. Carney if she didn't put up CDC, Department of Health, the World Health Organization, and of course the New England Journal of Medicine is always, these are the resources that Dr. Carney goes to, and I bet Dr. Burns does as well, and I know Michael does also. So these are the resources that we really recommend that you keep an eye on. So I wanted to go back to a couple questions. We had a really great question from Sarah, and this would be for you, Kath, is are there resources for English as a second language speaker through the COVID support VTE?
Yeah, I saw Sarah's question. I was really grateful that she put that in there because I neglected to say that, yes, we have, because we're embedded with 211, we have access to interpreter services. One of our counselors is in fact bilingual in Spanish, and our literature that you can find on our site that's also downloadable in our media center is translated into a number of different languages because we wanted to make sure that people could access it who needed it. So thank you so much for asking that question.
Yeah, that was a great question. Thank you, Sarah, for doing that, and thank you, Kath, for sharing that information. Dr. Carney, we had a question a little bit ago from Melanie about the vaccines, and I know, oh my goodness, what an amazing week it has been to see people get the vaccines here in Vermont and all over the place. So, but allergies, you know, I think there's still questions in terms of if you do have allergies, is this something that you know, what could you expect? And I don't know if we know yet, but that's a question many people are asking.
I think that, and I'm going to refer people to talk to their own primary care providers, you know, first about their specific situations, because I don't really want to give medical advice in this setting. But generally, what you have to look at is there are vaccines we know that if you get, as an example, a flu shot, you might have a sore arm. A smaller number of people might get aches and pains, and maybe even a low-grade temperature. So there's kind of the expected reactions. I think people can check when we get to that point where it's rolled out to the general public and how we will access it. That's the time to connect with your own primary care provider.
Good advice. Thank you so much. And I do see a few other questions coming in. Just want to give everyone a chance to ask those questions as we wind down here. Dr. Burns, I have a question for you. Fatigue with being on computers and fatigue of, you know, the resources available to me to help with my mental health are on the computer, you know, so how are people dealing with that? Is that something that's real that people are talking about with the COVID Support Vermont?
Well, fatigue with video is completely real, and I think, well, I know I certainly struggle with it after a long day. I think it's good to take breaks from the computer, and we do have this thing called the telephone that we can use to connect with people too, and I would encourage people to use that. And then if you're able to go out and meet a friend outside and take a walk in a distanced way, that would be, you would tick off many boxes on that wellness list that we went through earlier. Yes, take a break from your screen. But that said, if all you have available to you is a screen and video connection, please do that to connect with people rather than not, because that has been shown to be helpful in lieu of nothing else.
Absolutely. Thank you for answering that question. Michael, we have a question from, looks like Chelsea, asking, other than volunteering at the food bank, do you have any other suggestions or ways to decrease the food insecurity disparities?
Yeah, I think you bring up a good point about volunteering at a food bank. That'd be great. But in terms of on a community level, thinking about trying to avoid hoarding and panic buying, which luckily for us has kind of died down, but also, letting people know to pay attention to designated times for people who may be at increased risk, to allow them to have access to food in a safe way. And then on a personal level, if you have friends, neighbors, loved ones who have trouble with accessing food, to try and check in on them, see if they could use some help with getting groceries. If you're making a trip and you could reduce the trips in half by going for them and bringing it to them in a safe way, that'd be a great idea too. And it shows in the studies that we've done that a lot of people do appreciate also getting home cooked meals from people that care about them, who also take it as a chance to check in. So I think that those would all be some good ways to address food disparity.
Thank you for those suggestions. And I have seen our communities just coming up with such creative ways. There were meals opportunities. I live in Essex, and there were meal opportunities that we could provide to our seniors in our community. And so just finding those opportunities, I think there's many out there. So while there might not be the in-person volunteering opportunity, whether other things that you can do to support as well. I know, Jan, you don't want to ask dole out any medical advice today, and I respect that. But I know that there's related to the vaccine. Young children aren't on that list yet. Women, pregnancy. How is that being addressed related to vaccine?
People are 16 and older right now for the first one, and I think we're going to see that is currently looking at another one of those for the emergency use authorization, and we'll like to see a decision on that anytime. Part of it will be recommendations will come from that and from CDC and from state health departments about specific groups who are eligible for the vaccine. So, for example, again, this is another circumstance in which people should check with their own primary care provider, depending on their circumstance. A lot of that information will be forthcoming. People are very cautious. So again, I want to express my confidence in the steps that federal FDA is taking and that scrutiny. And that scrutiny will continue after the vaccine is being out and delivered, to look for any possible additional adverse effects in any groups of people. But they will be cautious to recommend those people for whom the vaccine has been tested in those clinical trials. So let me just stop at that point.
Great, thank you so much. And I think this is a really important question that is asked, and just making sure that these resources are equitable and the information gets to everybody. And I know that's challenging. And maybe Dr. Burns, do you have any thoughts on that as well, as to, especially your resource of COVID VT, how do we help everybody find out about these resources?
Yeah, again, that's a really great question. And there's communities in Chittenden County and then a lot of outlying rural areas that don't have the same access or comfort with, and I'm not making a generalization, it's just different access. So actually our organization has been doing a lot through the web, but we're doing a lot through newspapers, radios, PSAs, we use flyers, handouts, mailings. We're being as creative as we can and trying to work through existing networks of schools, food banks, whatever, to get information out. So we're trying, and we're open to other suggestions.
Nicole, if I could also add, I want to give a shout out to our own Vermont Department of Health, because they have the district offices. They do an incredible job getting out that information, and they're going to work really hard and continue to work really hard on partnering with all kinds of organizations throughout the state and UVM and healthcare professionals. So all of those things, people are going to do everything they can here. I really think they will.
Yeah, I think that's a really good point too. And there was a specific question, Dr. Burns, as well. And I would imagine as the marathon continues, is struggling with lower work performance, just trying to keep going. And I think that's a lot of what we're all feeling is it's there's an end. We're seeing there's light, there's encouragement, there's hope. But oh my gosh, this has been a long 9 months.
There are some studies I've read do show that people are showing lower productivity at work, kids are showing lower productivity at school. And, I think we just have to keep in mind that we're doing the best that we can. And people who are managers and teachers are to keep in mind that their employees are dealing with a lot of stress, and they are too, and to ask, how can I be helpful? And to maybe reprioritize work so that people can do the best they can in this somewhat untenable situation that will end.
Great. Thank you so much. It is 5 o'clock. I want to be mindful of everyone's time. Thank you, Dr. Carney. Thank you, Dr. Burns. Thank you, Michael. So fortunate that we have you to share this information with the community. I can't express our appreciation enough. I wish you all the best to stay safe, stay healthy, and best wishes for wonderful holidays. Thank you, everyone who joined us, and we'll share the recording and the information out with everybody. Thank you all. Have a great night.